and welcome to Rad Chat live here at UKIO. My name's Joe McNamara and I'm joined by fellow host
Naman Joker Anderson.
So we have two guests on the sofa joining us. Would you like to introduce yourself, please?
Yes, so I'm David Woolf. I'm a clinical oncologist based at the Christie in Manchester.
And Matthew Hatton, I'm also a clinical oncologist based at Western Park Hospital in Sheffield.
So, what are you doing here at UKIO?
So we were kindly invited to talk mainly about the tourist platform that we lead together. So that's a large phase 3 platform looking at 2 radiotherapy studies, and that's what we've been talking about today and trying to promote today.
How did you come up with the name?
With great difficulty, I think, is the short answer. No, I mean, the study is looking at sort of palliative radiotherapy treatments in lung cancer. The evidence base that we have for that is now 30, 40, 50 years old. So Taurus is very much trying to bring palliative radiotherapy treatment into the sort of 21st century, if you like.
And so in terms of kind of the study, talk us through kind of why you felt it was needed in the first place.
Yes, so as Matthew said, palliative radiotherapy, our practice, it's something we use every day to treat lung cancer patients, palliative radiotherapy, but our data is quite old.
Yeah.
So as Matthew alluded to, our data is 40 to 50 years old. We've changed a lot of what we do nowadays, so we've got better imaging techniques. We clearly give a lot of systemic therapies that weren't around then. We're using different quality of life metrics, so we're trying to bring what is old data back into the current regimes that we use to try and actually use that for patient benefit. So that's why the Taurus trial was developed.
How has it been perceived, I guess, by the clinical community?
Well, it's been a long time in evolution. I started work on these sort of palliative radiotherapy studies probably 20 years ago. This particular radio study, we started work 2018, 2019, and then got funding through the NHR. It is a platform study, so hopefully any patient who needs palliative radiotherapy treatment, we will find a sort of a study niche for them, so they can have that treatment as part of a trial. At the moment we've got a couple of open studies. One is PRINCE, which is looking at radiotherapy alongside their standard systemic treatments, so for the fitter patients. For the patients who aren't able to get or aren't fit enough for systemic treatments, we've got the Quartz Lung study. So there are 2 studies there recruiting. I think we've got 130, 140 patients on the platform so far. But we are looking for somewhere around 900, so there is a way to go.
Okay. And do you find you struggle to recruit within this space?
So it's a difficult patient population, I think. So as Matthew said, we've got PRINCE and we've got Quartz Lung. PRINCE has recruited fairly well overall, so that's been easier to recruit to. I think Quartz Lung has been more challenging. I think patients are less fit, I think less keen to go into trials, and often they're not necessarily coming to oncology clinics, so we don't have easy access to that patient group, I think. So it's just trying to reinforce that message and make sure that patients are at least able to see somebody who can offer them those studies is what we're trying to get out of this.
So we have quite a big patient following and people that listen across the world. When you say less fitter, what do you mean by that?
Yeah, so in the Quartz Lung group, by definition, it's patients who are not having systemic therapy or have finished their systemic therapy, so they may be less fit than other patients are. And that's why we've got these 2 studies in parallel so that patients can go into either of them depending on what's right for them. But often we find in practice that patients who are less fit, there's a lot to go into a trial, there's more visits, there's more things for them to engage with, so that can be a challenge, and part of our job with our patient and public representation that we have on the trial is really to try and work out what we can do to break down the barriers, because the trial's been designed in an inclusive way to try and capture everybody, so we're just trying to help that actually to happen and facilitate stuff.
What are some of the preliminary findings from what you've done so far?
But I think before I answer that question, I would like to pay credit to the patient representative we've had on the study. They have been involved in this study from the outset, so it really has made it very focused, and we are hopefully answering the questions that the patients want answering rather than the questions we as researchers think they should have been answered.
Yeah.
I feel I've forgotten your question.
So what are the findings from the research?
It's a little early to say. I think we did present a little bit of data today around the sort of the quality assurance program that we're running with the trial. So part of that is about ensuring that the 35 centres that are signed up for the studies are all delivering the radiotherapy treatment to a very high standard. So we did present a bit of data around that today, but in terms of the overall impact of the study, I think we're a few years off being able to present data for that.
Amazing. Well, thank you for joining us on Rad Chat and joining us on our very small sofa.
Very small. Very small.
Thank you.
Thank you.
Thank you.